Good morning, students. Welcome in HCP lecture. Today I will start the lecture of hospital and clinical pharmacy in that part 2, that is clinical pharmacy. Let us firstly look at the what we saw in previous lecture. Okay. In previous lecture, non-sterile manufacturing chapter conducted. In that, definition of non-sterile manufacture, that is non-sterile manufacturing concerned with fabrication of dosage form except parenterals which is carried out according to standards laid down under the Schedule M and N of Drug and Cosmetic Act 1945. Then introductory part of non-sterile manufacture, then space requirement, then next point is manufacturing department, in that cleanness, raw materials, then manufacturing procedure. Then next point is equipments, in that method of granulation, three methods of granulation: wet granulation, dry granulation. Dry granulation is also known as sludging, and third is direct compression. Then second point, manufacture of pills and compressed tablets, in that granulating section, coating section, capsule filling, ointment and liquids. Then third point is bulk concentrates. Then next point is procedure for bulk compounding, then commercial production of emulsion. Okay, in that mixers, four classes, and that is first is mixer, second homogenizer, third is colloid mills, then ultrasonic emulsifier. Okay, and last point is manufacturing of suppositories, in that mold, calibration mold, then displacement value of solid medicaments, then method for determination of displacement value, then example, then in that general method prepared for suppositories containing insoluble solids. Then four stages: stage 1, stage 2, stage 3 and stage 4. Then preparation of suppositories by fusion process and suppositories made by compression. These are the part of non-sterile manufacture. Now see the today's chapter number 6, that is drug interaction. In drug interaction, introduction, then reasons of drug interaction, then role of pharmacist in drug interaction, then mechanism of drug interaction, then drug-drug interactions and drug-food interaction. Okay, firstly I will start the introduction of drug interaction. Okay, day by day developments of new therapeutics, then chemotherapeutics or other category drugs are raising challenges to clinical field. However, accompanying of pharmacological actions produced by the use of these drugs also created its related problems in the form of unpredictable adverse reactions. The phenomenon of drug interaction cannot be correlated with drug or therapeutic incompatibility because it occurs merely due to the pharmacokinetics or pharmacodynamics changes taking place inside the body. Then definition of the drug interaction is: the drug interaction can be defined as the effect of drug altered by another drug or food that is prior or concurrent administration with it. It is termed drug or drug food interaction. What is the definition of drug interaction? That is, drug interaction can be defined as the effect of drug altered by the another drug or food that is prior or concurrent administration with its. Then it is termed drug or drug food interaction. The next point is reasons of drug interaction. First is use of OTC drug, second patient non-compliance, third is multiple physicians, fourth is drug abuse or misuse, and fifth is potent drugs. Now see the first, use of OTC drugs. In that, without consultation of physicians, use of OTC drugs like aspirin, antacids, then nasal discongestant, etc. with prescribed drugs can result into the drug-drug interaction. What is the use of OTC drugs? The without consultation of physicians, use of OTC drugs like aspirin, antacids, then nasal decongestant, etc. with prescribed drugs can result into the drug-drug interaction. Then second is patient non-compliance, in that many patients do not adhere to the instruction of prescribers or pharmacist advices on prescribed drugs. Example is a diabetic patient is strictly advised to the prevent alcoholic drinks, liquor to avoid further hypoglycemic crisis. Okay. Then next is multi-physicians, in that a patient receiving a treatment from multiple physicians from different illnesses. In multiple physicians, a patient receiving a treatment from multiple physicians for different illnesses. Then fourth is drug abuse or misuse, in that a thickening of patients that more consumption of drug will produce kick relief can result into the drug interaction. Then fourth is potent drugs may produce many pharmacological actions of different physiological systems organ is one of the cases to produce the drug interaction. Okay. Then next point is role of pharmacist in drug interaction, in that a pharmacist is well versed with pharmacokinetic and pharmacodynamic of drug. Then he is ideal person who can play a vital role in preventing interaction of drug by advising the patient on the following. That is, do not use OTC drugs without the consultation of physician. Then second is strictly follow the instruction given by the physician regarding administration timing and dosage. Then third is, if receiving treatment from multiple physicians, inform them about the illness before taking the medicine. Okay. Then fourth is, do not consume drugs in excess apart from recommended dose. Then fifth is, do not take different drugs at once. Then sixth is, which type of food is forbidden for a particular drug. First, what is the first advice? First is, do not use OTC drugs without the consultation of physician. Then strictly follow the instruction given by the physician regarding administration timing or doses. Then receiving treatment from multiple, if receiving treatment from multiple physicians, inform them about the illness before taking the medicine. Then do not consume the drugs in excess apart from recommended dose. Then do not take different drugs at once. The different drugs are do not take at once. Then which type of food is forbidden for the particular drugs. These are the role of pharmacist in drug interaction. Then next is mechanism of drug interaction. First is pharmacokinetics and second is pharmacodynamic interaction. Firstly, we have seen the pharmacokinetics. Firstly, mechanism of the drug interaction, in that the mechanism of drug interaction comprises pharmacokinetic and pharmacodynamics, which means what the body does to the drugs and drug does to the body respectively. Okay. Then kinetics includes drug absorption, distribution, metabolism and elimination, where pharmacodynamics are the numerous action of drugs on the body system or their organs. The mechanism are discussed below. Then pharmacokinetics, in that GI absorption. Okay. The GI absorption, delay in absorption or interference with effect of onset of action of the drugs. Numbers of factors alter the process of absorption as given below. First is change in pH, then absorption or complexation of drug, then GIT status and other factors. Firstly, change in the pH. What acidic drugs are readily absorbed from the stomach because they remains in unionized form. Example is salicylates. Basic drugs are easily absorbed from the intestine. In the adsorption of or complexation of drugs, activation charcoal and kaolin acts as an absorbent, so are given in the case of poisoning and diarrhea to absorb the unabsorbed poison and bacterial toxins, etc. Okay. Then next is GIT status. Decrease in the GIT motility and emptying rate alter the rate of absorption. Then other factors, presence of the other agents either favor or decreases the absorption of drugs. Then alteration in distribution, affinity and efficacy of the drugs to bind with plasma proteins alerts the displacement from protein binding site. Okay. Then third, C is the change in metabolism, in that enzyme induction and enzyme inhibition. Okay. The enzyme in induction, that is increase in the enzymatic activity, enhance the fate of drugs, which decreases in the therapeutic effect of drug. In that alcohol, phenytoin, chlorohydrate are enzyme, then inducing the drugs. Then enzyme inhibition, that is decreases in the enzymatic activity, prolongs the fate of drugs, thereby increasing the effect of drugs. Then last is change in excretion. First is pH of urine and competitive excretion. In pH of urine, ionized drugs easily diffuse and are excreted in the urine. So any drugs that changes the pH of urine affects excretion of weak acid or weak bases. Then competitive excretion, in that renal tubular transport between the concurrently administered drugs generally changes excretion of one other. Okay. Then next is pharmacodynamic interaction. Okay. The next part we have seen in in next lecture. Okay, I will stop here. Thank you.